Good morning, and welcome. We are getting ready to start right now, and I'm so excited that you have decided to join. So, we are here and we are about to begin our 1 hour workshop on how to launch your profitable healthcare staffing company. Let me take a look at these comment here to make sure you're hearing me. Good morning. Yes, you can hear me. Thank you so much. Thank you. Thank you so much for responding to that. Okay, great. We are here and we are going to get right into our 1 hour workshop. We are going to go through this presentation. It's going to be very, very short and to the point of how to launch your healthcare staffing agency. And after that, we'll have question and answer, and then I will share with you how I can assist you in moving forward to launch your own staffing company. All right, once again, my name is Eva Francis. I am a registered nurse and a former hospital nurse executive, and also a nurse entrepreneur. Um, my journey started in the hospital where I navigated from the bedside to the boardroom, was a hospital leader for many years. After that, I reinvented myself, transitioned out to launch my own profitable business. I started in training and consulting, and then navigated my way up to training, consulting, and staffing. Staffing, particularly because today, when we looked at what's going on in the healthcare industry, we realize that there's a need for staffing is so great. The need for consulting is great. The need for training is great. But also the need for staffing is so powerful. You know, I had the opportunity recently to interview a few hospital leaders, and they're my friends. Some of them are hospital directors, some of them are chief nursing officers. And the question that I asked them was this: what one thing keeps you awake at night? Do not say patient safety, because I know they're going to say patient safety. Tell me the most important thing. What keeps you awake at night? And without any hesitation, they all say that what keeps them awake at night was staffing, recruitment, and retention. So if you are a staffing agency out there and you have what it takes to connect great healthcare professionals to organizations, healthcare organization, you will flourish and you will thrive. So I'm here to share with you how we have started our company, how we have done it. I'm going to share with you all the nuggets, all the tools, all the strategies, because at this time we have our staffing company for over 5 years, but in the last year and a half, we have soared in leaps and bounds. We have really taken off to the next level. We have actually had people calling us to ask us, do you have nurses? Do you have CNAs? Do you have nurse practitioners? How can you help me? We train, we consult, but staffing right now, I see that that's such a priority, especially in this pandemic, which is still going on. And we want to support our organizations, we want to support our community, and we also want to impact and support our colleagues who are burnout out there, don't have enough nurses by their along with them to take care of patients and their families. So healthcare staffing agency is such a lucrative industry at this time. So if you have been thinking about starting a business that you can make an impact while you generate income, you are in the right place. You are definitely in the right place. If you're looking for a business that you can use to impact your community, to help everyone succeed, you are in the right place. And healthcare staffing company is not for everyone. And I'm going to share with you why I say it is not for everyone. So we have launched a healthcare staffing industry. We have launched a few years ago, but in the last year and a half, we have relaunched our healthcare staffing university. Healthcare staffing university, meaning that we are a staffing agency that serves the community. We send healthcare professionals to many organizations in the Florida and Atlanta area. And we are also a company that we train nurses and other healthcare professionals. We consult with them how they can to launch their company and be successful. So here's how you can launch, and here are the steps that you need to learn this. And I love to teach how to discover that hidden treasure. There's a hidden treasure in healthcare staffing, and I want to teach you how you can discover that hidden treasure that is there for you. If you don't know how to find it, you won't know about it. And when we're talking about healthcare staffing agency, healthcare staffing company, we are talking about, in a nutshell, how do you supply healthcare companies with staffing? That means, number one, how do you supply physicians' office with nurses, CNAs, secretaries, any persons that can be of help in the healthcare industry? How do you supply, or do you connect healthcare professionals to the schools? How do you connect healthcare professionals to the hospitals? Especially, that's a big one. How do you connect them to the prisons? That's another one. They need nurses in the prison. How do you connect them with the federal government to do vaccines, COVID-19 vaccines? There's a lot of opportunities out there today, but you have to dig deep to discover the hidden treasure in healthcare staffing. And that's why we're here today, because this healthcare staffing treasure will be discovered by those who have decided to follow the steps that I'm going to share with you, and you want to work the steps. Many nursing staffing, healthcare staffing companies are out there today, but they just have a name. Unfortunately, they have a beautiful name, they have a beautiful logos, they have a beautiful website, but they are not making any money because they are not digging deep enough to find that hidden treasure in the industry. Healthcare staffing company is for those who have a vision to succeed. Do you have a vision to succeed this morning? If you have a vision to succeed, it is for you. Healthcare staffing company is for those who are willing to carve out 2 to 4 hours daily to work on their business, not necessarily to work in the business, to create steps, to make the calls, to send out the emails, to connect, to network, to communicate. You can make it, because there's a treasure that's hidden that you need to discover. And when our company, when we discover that hidden treasure, we realize that we need to share this with many other healthcare professionals, because this is such a deep treasure that's there hidden that many people don't know about. They've heard of agency nurses, and people said, "Oh, I don't want to work with agency nurses." But we are here to change that concept, to dispel that myth. You can have an agency or company, or however you want to call it, and you supply healthcare professionals in organizations that they will search for you. You will be the employer of choice. Today, in one or two of our companies, in our local medical center, large medical centers, organizations, they are seeking for our company. Our company is Brilliant Healthcare Staffing. And you can tell, they talk about us in staff meetings. We hear it all the time. They talk about us, they say how good our nurses are, how good or great our CNAs are, and they love to work with us. They seek us out. And I want to help you to discover that hidden treasure. The hidden treasure is for those who believe that they have the power to get wealth. It's for those who will make the calls every day, send out emails every day, and those who are ready to ditch that fear and do it afraid. Many people are so afraid to make the call. Many people are so afraid to tell people that they have a staffing agency. It's not for you if you are going to be shy and hide it, and you are going to cover it up and not let anyone know about it. It is not for you. This is something that you're going to be transparent about. You're going to share it, and you will be successful. Discover the hidden treasure in healthcare staffing. It's for those who are ready to stop listening to the naysayers. The naysayers, like the negative Nancy's and the rebellious Rebeccas, who are going to say, "Oh, it doesn't work." I am telling you this morning, my name is around, and you can Google my name. I'm telling you the truth. I can tell you right now, if you work it, it will work. I am not here to tell you something that is not working. This thing works, but you have to work the plan. You have to work the blueprint and make it happen for you. It's just like any other business. If you're a consultant, if you're a teacher, if you're a trainer, and if you're an entrepreneur, you have to work it. Because someone said recently that entrepreneurship, or nurse entrepreneurship, or healthcare entrepreneurship, is not escaping the bedside. One of my nursing colleagues, her name is Santasia Walker. She defined nurse entrepreneurship as this, and I love it. She said, nurse entrepreneurship is not about escaping the bedside, but it is about availing yourself for opportunities to be creative, to be innovative, and at the same time, you soar and you flourish in the healthcare industry. And I think I have change up some of our words there about, but that's what it's all about. It's about making yourself available for the opportunities. You know, COVID-19, the pandemic came, and what we had to do is, I don't like the word pivot. I like the word elevated or move forward. Many people talk about pivot, but pretty much what we do is really elevate ourselves instead of pivoting. Because when you use the word pivot, that means you're going around circle, you're staying at the same level. But we did not pivot. We actually switch or change, make some changes in our business. We shifted a little because here's the thing: we have been training, we have been consulting, we have been staffing, but we really realized that our company or our clients, our hospital clients that we have, and our physician offices, their their needs right now were staffing. So we have switched a little bit to enter into the staffing company to place most of our time in the healthcare staffing business. Are we still consulting? Yes, we are. Are we still training? Yes, we have a lot of online training courses that we are doing and everything. But right now we are focusing on this because that's where the need is. We get calls all the time from companies and from hospitals and from leaders. Do you have nurses? Do you have healthcare professionals to help us out? And that's why we want to help them. We want to help the community. We want to improve patient care. We want to make sure that the nurses have enough staff alongside them to take care of patients, their needs, and their families. Healthcare staffing is not for those who are easy to give up. Healthcare staffing is not for you if you're quick to quit. Healthcare staffing is not for those who are afraid to hear the word no, because when you reach out to organizations at times, you are going to hear the word no, we don't need your service. But guess what? You're going to keep moving on. Entrepreneurs are resilient. They really step out, and even if they hear no 10 times, they're going to continue to pursue. Because when a company says no to you, we don't have any contract, or we don't want to partner with you, they're just saying, call us back in a few weeks or a few months. That's actually what they're saying. So you never back out and give up and throw in the towel and say, I'm not going to do it again. It doesn't work like that. We have heard several no's in our companies, but we have heard several yeses. Healthcare staffing is not for those who are afraid to hear the word no. Healthcare staffing is not for those who don't have a vision to succeed. You have to envision yourself, imagine yourself succeeding in this industry. Healthcare staffing is not for those who are not clear with the staffing message, because when the message is clear, the result will appear, meaning that you carve out your own niche. What niche do you want to supply? Do you want to work with just secretaries and office assistants? Do you want to work with just CNAs? Do you want to just supply only CRNAs or nurse practitioners or just respiratory therapists or managers? Who do you want to supply? Do you want to supply them with managers or just directors or leaders or just nurses or whoever? Just carve out your own niche and make sure your niche is as narrow as possible. You reach out and you get clients. Healthcare staffing is not for those who are surrounded with negativity, and healthcare staffing is not for those who are literally inconsistent. You cannot be inconsistent and succeed. You have to be consistent, you have to be visible, you have to be transparent, you have to be always there, and you'll be successful. The global healthcare staffing market, right? It's estimated at 33.8 billion in 2020. Can you imagine in 2021 now with the pandemic continues? So there's a significant rise in the geriatrics population. And that has been one of the major contributors to market growth over the last few years. And now comes COVID-19. So guess what, guys? Hospitals, physicians' offices, the government, prisons, schools, they are hurting for staff. They're hurting for nurses They are hurting for respiratory therapists, allied workers. They are hurting for CNAs. The schools these days, with COVID-19, many schools are looking for nurses to work in their company. Get a contract with them. Send out some nurses. What are you waiting for? So organizations are depending on supplemental staff. So today I'm going to focus mainly on supplemental staff rather than contracts and travelers. And yes, you can, with this program, you can do contracts. Yes, with this program, you can do travelers. But I'm going to focus a little bit more on supplemental and PR and staffing. So what's the first step that you want to? Step number one. And if you're there, you can take notes. Step number one is the vision. Have a vision and work the vision. You have to have a vision, and after you work the vision, how do you work the vision? You work the vision by making a decision, because you have to decide that you are going to work that vision, because a vision without an action is just a dream. So when you have that vision and that idea, you have to execute it. Execute that vision. You can't just have it on paper or post it on social media that I have a vision. There are a lot of cute posts out there in social media. There are a lot of cute flyers out there in staffing agencies. There are a lot of cuteness and niceness, and that's all good because I post too. But you can't just have beautiful flyers out there. You're not working the flyer. You're not working the vision. Sometimes some of us need to step back, get off social media and work the plan, because there's a market of social media that a lot of people are not tapping into. So I'm promoting on social media and off social media. So without the vision, you're just dreaming. So make sure you have that vision to succeed. Step number two, if you're going to launch your staffing agency, step number two, you have to make it legal. Make your company legal. Sorry, drinking some water. And how do you make your company legal? First, you need a business name. Create a business name, and don't have a name that somebody else has, or a name that is close to someone else, or a name that nobody can pronounce, nobody can write. Because the truth is, healthcare leaders are sometimes many of them, they're quick, they're not so patient that they're going to be trying to spell your name and trying to pronounce it. If you give them a name that they can't even pronounce, they're moving on to the next one. I have been there. The reason why I'm qualified to teach this class, because I was a decision maker at the time when I work in organization. I was one of the decision maker. I was an associate chief nursing officer. I was a hospital administrator, nurse executive. I was director over the critical care, over the ER, and then became a senior director, then became an associate vice president of nursing over all these areas. And I have seen agencies come in, and we had to make the decisions along with human resources. Some organizations, HR make the decisions. Some organizations, chief nursing officer make the decision. Sometimes the nursing supervisor, sometimes the scheduler, sometimes the staffers make the decision. So I was a part of the decision makers. I run a successful staffing agency right now. I have over 200 nurses, active nurses in our pool. They are all the way out there over the in our country, in our state, working, and I have workers that are helping us in this organization. But the truth is, it is successful, it is sustainable, and it's really enjoyable. So when an organization call and ask for 8 nurses or 6 nurses or 10 nurses, and if you have those nurses ready to go, and I'm going to show you how you're going to make your nurses and your CNAs and your healthcare professionals ready to get out there and be there. So have your business name. That's number one. And as I said before, don't make it clear that your business name is a staffing company. Don't have a business name, and in that business name, you're teaching, you're selling books, you have staffing, you have training, you have consulting, you have Shopify, you have this, you have clothing line, you have hairdressing, you have whatever. You can't, just be clear with your staffing companies that your name is, like our brand is Brilliant Healthcare. So we have Brilliant Healthcare Consulting. We have Brilliant Healthcare Staffing Agency, or Brilliant Healthcare Staffing and Consulting. So if you check out the organization this morning where our nurses are, and you ask them, what company do you have in your organization this morning? They're going to say, we have Brilliant Healthcare Staffing. That's our name. They don't know us as another name. They know us as Brilliant Healthcare Staffing, and they call them the Brilliant Nurses. And that's all good. I love when they say, "Oh, we are the brilliant nurses." I love to hear that. I get a lot of good report about our nurses all the time, because why? We train them and we prepare them to do the best. We communicate with them. We have an email list. We send out emails to them on a regular basis. Or we treat our agency. I treat my company as like I'm the chief nursing officer there, like I treat the hospital. It's not a fly by night thing where you just have nurses and you don't know anything about them. You communicate with them, you network with them, you text them, you email them. How was your night last night? How was it? Don't, how was, you went on a vacation. How was your vacation? You have to take good care of your nurses. And that's what I did when I was in the organization before. And I do the same thing now, and it is working. I'm encouraging you to connect with your staff if you're out there and you have an agency or a staffing business that is not working. Maybe you need to step it up with your team a little. So you must have a business name. Also a business plan. You must have a business plan, but be careful when it comes to business plan. I am not a supporter of a business plan that is 40 pages, 30 pages, that makes no sense. A business plan will steer your business in the right direction from start to growth. Think of your business plan as your GPS, right? It's like your GPS that target your business, how your business is going. A good business plan will guide you through each stage of your business, each stage, and a good business plan will help you to structure your business, to operationalize your business, and to grow your business. And it can help you with funding. If you're taking it to the bank, sometimes you want funding, or investors. If you want to connect with an investor, they want to see that you have a business plan. However, don't if that's not the case, where you are going to place your business plan with another investor, so make sure your business plan is simple and you can read it and you can understand it. I know of tons of millionaires right now, a lot of millionaires today launch their business without a business plan. Am I advocating for business plan? Yes, but make it simple that you can read it so that you can understand it. Don't have your business plan with pages that you just throw it aside and you never look at it. It will help you to get funding, help investors feel more confident that they will see a return on their investment. So make sure it's very simple. You must establish a business entity, whether it's an INC or an LLC. You must have an EIN number, register your business, have a business account. These are the legal aspects of the business. And we have a mentoring company, mentoring program that we teach you how to be legal in your business. Also, depends on which state you are from. If you are from the state of Florida, you need a specific license from ACA, from the state of Florida. If you're in Arizona, you need a specific license. There are places like state like California and Texas. You don't need a specific staffing license, healthcare staffing licensure to work in those states. But many states, you need a license. If you are in New Jersey, you need a specific license. Nevada, North Carolina, depends on where you are, but check out your state and see, do I need a specific license? And the states like California and Texas, that don't need a license, Alabama don't need a license, a specific license. What you do, you register your company with the Secretary of State. You must register your company just like a regular business, and have your EIN number, have your business account, and make it legal. Remember that state rules vary. Rules vary. So if you're going to start, after you make that decision that you are going to execute the vision, the next step is to make your business legal. And the way you want to make it legal is to establish your business name, your business plan, your business entity, and your get legal. In addition to that, you want to make sure you have professional liability insurance. That is a must. Everyone needs a professional liability insurance because you have to protect your team. If there is an error, medication error, or anything like that, you have to have up to $3 million professional liability insurance. Or you know what? Let me take that back. It's according to your state. In Florida, it's up to $3 million professional liability insurance, and it's really not a lot of money. You can get a professional liability insurance like anywhere between $700 to $1,200 per year. You can get it something like that from, and the places that you can check out NSO, you can check out Cover Wallet, or you can check out BizInsure. Those are some of the companies that you can check out. Paychex, Paychex. It's a company, payroll company, and they are all a professional liability insurance. Or you can Google and do your research. Find the one that suits your need and the one that is less expensive. General insurance, you need general insurance to cover what your business, your building, and if there's a slip and fall, that kind of a thing, you want to be covered. Workers' compensation, if you have your company, your employees as W-2, or versus if you have them at W-2, meaning that they are staff, they're employee, you must have workers' compensation to protect them. If something happens to them on the job, you want to protect your team, you want to protect your business. So workers' compensation is very important. And that can be a little bit pricey, but you have to check it out. It's so important that you check that out as well. So these are some of the ways you are going to get legal. Your insurance, your workers' comp, your income tax, your being legal, your EIN number, your registration, be legal. That's second step after you launch a vision, be legal. Step number 3. Let me talk about funding. Funding your business is step number 3. Self-funding, savings or family, or you can get loan from family members, or a personal loan. You can get capital funding, or you can have a home equity, a line of credit from the bank, or many other options. But funding and finances are important. And don't get so scared or hung up with funding and finances when I say that, because you can launch your staffing company with very little amount. I have known people launch a staffing company with $2,000, $3,000, and hold on a little bit. Before you say anything, hold on. I am not saying that all companies are the same. It depends on your clients. It's going to be dependent on your client. Hold on a second, please. Yes, it depends on your clients, because if you get a client that pays you very often, like every week or twice a week, you may not need a whole lot of money to pay your team, but it's good to have at least 3 months salary to be safe, because you don't know if you're going to get a client who's going to hold on to your invoice and don't pay you right away. But if you're blessed and you're lucky, you will get some great clients, some great hospitals around town. They love to pay, and they pay right away. Some nursing home love to pay. Some will take a little long time to pay, and that will all be in your contract. But you should have some amount of money just in case you don't get the payment right there from your company to pay your team, because your team is not going to want to go to work if you do not pay them. So the funding is super important. The other step is the hiring process. And you know, a lot of people, there's a big there's a question as to whether should you hire before you get contracts. Should you hire before you get a contract? In my opinion, both of them come first. Both of them work, hand in hand. Hiring staff and getting contract. But if you have to do any before the other, I would say hire first. Here's why. Because if you go there and you get a contract and you do not have any nurses, you do not have any CNAs, you do not have any LPN, you do not have any nurse practitioner, you do not have any unit secretaries to send, and they start calling you and you don't have anyone, believe me, they are going to put your name aside and don't even continue to call. So make sure that when you're presenting your contract or presenting your business to an organization, you at least have some healthcare professionals, some staff so that you can call on them if you get a contract right away. Sometimes, in many cases, the day you sign the contract is the day the staff in the office call you. I need 4 nurses. I need 3 CNAs. I need 2 respiratory therapists. They will call you. So be careful how you are getting contracts without staffing. Both of them hand in hand, but use your discretion and make sure that you have people available. I told my team we have a weekly workshop that just ended last week. And one of the things I told my team is that if you plan to be the nurse or the worker when they call, that's fine. Because many nurses start their company, when they get the contract, they be the first employee. They be the first contract. They send themselves into the organization. Maybe if you're out there and if you're an ICU nurse, if you're a step down nurse, if you're cath lab nurse, if you are ER nurse, and they call you and you can go, you go. It's okay. And you don't even have to be afraid to let them know that this is your company. It's up to you if you want to share that information or if you want to not share that information. It's up to you. But you make sure you hire nurses, hire CNAs, hire professionals, hire staff to be in your company. Hire qualified professionals. Make sure that they have all their credentials, and make sure that they have everything in place and ready to go, because many organizations will ask you to send them their profile, and that is why it is so important. How are you going to get these professionals? On the internet, advertise on Indeed, word of mouth. In our company, oh my God, word of mouth is such a powerful thing, because many, I'll say 90% of our staff that we have, over 200 nurses, and we focus on registered nurses. Our company is all nurses. We started up with critical care and ER nurses, but now we got critical care, ER, and step down and telemetry and med surg. We do all nurses. And of course, nurse practitioners. And everything is word of mouth. People tell each other. 90% of our team is word of mouth. And I feel so blessed to know that people are telling others about it. So build your company in such a way that others can tell others about it. And what they love about your company, what they will love about your company, the fact that you're flexible with your scheduling. You don't own their schedule because they're per diem, there's part-time, unless that's a contract or traveler, that's a different thing. You pay them on time. You don't wait 2-3 weeks before you start paying them. Their paycheck is always wrong. Don't do that, because nurses these days and healthcare professionals, allied workers like respiratory therapists, case managers, all these workers, they have choices and they don't have to come to your organization. They can go, there's so many agencies around that's paying them big money. They will go there. So be very, very careful how you're treating them. When you hire nurses, these are some of the things you want to keep on their file. I have a list here, like their resume, their background screening, their education verification, make sure that they have a drug screen panel. These are some of the things these are the basic things that organization will look for. Their RN license, make sure it's not expired, make sure their BLS, their ACLS, their PALS if they are ER nurse, their a copy of their college diploma. Sometimes organizations ask for that. Their immunization record, their flu vaccine. They're not really asking for the COVID vaccine yet, but their flu vaccine. Make sure that the basic things are on their file. And some organization will ask you to submit everything to them. So you have to have it to submit. And some organization will say to you, you don't have to submit. Make sure that these staff, they are qualified. You have to ensure that they're qualified, because if Joint Commission jump into the hospital and review one of the patients that your staff takes care of and something is missing, that, like for example, their license is expired, you're not going to want that. That's going to be a bad thing for the organization. And remember, the hospital or the physician's office or the school or wherever you're sending our staff, they are your partners. So you want to protect them. You want to make sure that if they have a survey, they do well. Your staff is not in the organizations and cause them to get a tag. If the state walk in the organization and they pick a patient that your staff takes care of, make sure your staff is credentialed. Make sure they have everything, because you know what? The organization will call you at some point and say, hey, can you send me a copy of their PALS card? Or can you send me a copy of the nursing license? We have ACA here in the building. We have the state here in the building, and they want to see their license, and we don't have a copy. You better ready to have that going. So that is why you have to be really credentialed. And in our training and in our mentorship program that we have, we teach you about all the different things that you need for nurses and for CNAs and for staff overall to get ready. So you get ready, you stay ready. The marketing services, that's step number 4. You're going to market daily. And who are you marketing to? You're marketing for staff and you're marketing for clients. Because the 2 key things when it comes to staffing agency is clients and staff. Clients and staff. You want clients, which is your contract, your hospitals, your schools, your physicians' offices. But guess what? You need staff, because you need staff to work. All right, so you're going to market daily. Have a great website. Make sure you have it don't have to be an expensive website, but it's going to be a decent website. And we in our mentorship program, we partner with some companies who will give you a discount on website. Be out there in social media. Be visible in the community in social media, especially on LinkedIn. On LinkedIn, you will hear a lot. You can get clients and clients and staff on LinkedIn. Make sure that you brand yourself accordingly. Ensure that your brand stands out, and the organizations want to identify with you or want to partner with you. Because if you don't have a clear, clean, crystal branding, whether it's your website or your Facebook page, many organizations may not want to partner with you because they want to make sure they partner with the quality. So you want to step up your game as much as possible. So they are proud to say that they are partnering with you. You want them to say that. So be very, very careful that you're not partnering with somebody. You don't have you have a less than image. Another step, number 5, is your relationships. Relationships is equivalent to clients. And as I said before, your clients are hospitals, they can be long-term care, can be rehab, they can be schools, they can be the correctional department. And how do you get clients? Constant networking. You're going to gather referrals, constant connections with decision makers. When I say decision makers, I'm talking about decision makers in hospital. So when you call, you're going to ask, who are the decision makers as far as certain who are the decision makers as far as deciding on contracts are concerned? Sometimes it's the chief nursing officer, sometimes it's the HR director, sometimes it's the nursing supervisor, sometimes it's the staffing office, sometimes it's even the scheduler. Different organizations have different decision makers. So you want to connect with decision makers and communicate with them on a regular basis. Send them email. Make sure you follow up. You want to be visible on social media with your best brand image, particularly on LinkedIn. Look for government staffing opportunities. There are a lot of government contracts out there. They're difficult to find, but you have to dig deep to see which contracts. Do they have contracts to give vaccines for the COVID-19 vaccines? Is CVS have a contract right now? Walmart, Walgreens, there are contracts out there. Yes, those are hard, but you can, it's something that you have to work at, be constant at, and get all the information that you need as much as possible. You have to develop a proper follow-up process. You have to make sure that you follow up the process as much as possible. How do you stand out in the marketplace? You have to brand yourself, and you want to make sure that you are on top of mind by you have a company's name that is stand out because of who you are and how you decide to show up to these companies. You have to be unique, carve out a niche for yourself. Whether it's a dialysis, you want to carve out a niche, whether you want to serve ED nurses. To start, I would suggest that you, as I said, when the vision is clear, the results will appear. I believe that when you start a new brand, you should get just a niche for yourself. You just want to do, we started with ED and ICU. And when we started growing and getting contracts and leaps and bounds, we stepped outside of that and we decided to do telemetry nurses and step down and med surg nurses, dialysis nurses. You can do nurse practitioners. In our mentorship program, we have 1 or 2 of our students who are actually doing nurse practitioners. You can do nursing assistants only. You can do respiratory therapists only. That's a need, guys. COVID-19 patients in the ICU, they are intubated and they need respiratory therapists. Hospitals today have increased and are advanced in as far as the numbers of respiratory therapists that they have in their organization because they need them because of what is going on today. Finding your staffing niche is a key to successful healthcare staffing success. It's a key. Can you do more than one niche? Yes, you can. But I want to say that especially if you are a business owner with another business, you want to start with telemetry nurses, or you want to start with CNAs, or you want to start with one niche, and you grow and you advance and you expand yourself. Next step is pricing and billing. You have to decide on your bill rate and how is your bill rate. And what is the bill rate? The bill rate is a rate that you're going to bill the organizations. And then from that bill rate, you're going to pay your team, pay your staff, and still make a profit. That's pretty much what it is. You're going to pay your staff from the bill rate. So you're going to decide on the bill rate. And the bill rate is going to be depending and based on your current market today. Like today's market is a pandemic market, is a COVID-19 market, it's a crisis market. Your bill rate in most states today are a little bit higher because of the pandemic. So you're going to include that in your contract and you bill your organizations accordingly. And then you get a profit from a percentage after you pay your nurses. Make sure that you can look at what percentage do you want to make after you pay your nurses, or what amount do I want to make? $25 per hour from each nurses? Do I want to make $40 per hour from each nurses? And the truth is, even though you may say you're making $25 each from each nurses, it sounds a very like a low amount. But think about if every nurse you assign, you make $25 per hour. And I have the math here that I calculate for you. Say, for example, every nurse that you hire or every nurse you send out in the organization, every RN, you get $20 an hour profit from the billing rate. So you bill them $100, you bill the hospital $100, you pay the nurses $80 an hour, and say you make 20 an hour. I'm just throwing out a number. And if you schedule 2 nurses per day, you're going to make $40 an hour per day for 2 nurses. If you make, and for 2 nurses per day, if you schedule 4 nurses a day, that is 2 in the morning and 2 in the evening, you're actually making $960 for the day. Then multiply that $960 by 7 days, 7 days a week. That gives you $6,720. And then you multiply that by 4, that actually gives you $26,880 per month. And that is for one nurse, actually one nurse every day, every shift. But 2 nurses every day, every shift will double that, and that's $53,000. So the way I work it out and the way you should work it out is 2 nurses every day per shift, constantly. If every shift you make 2 12-hour nurses in the morning and 2 12-hour nurses in the evening, you can make a gross income of $645,000, more than $500,000 per year. And of course, you're going to have to filter taxes from that and your overhead and all these things. So my point is, just with 2 nurses every day per shift, look how much money you can make. But is it easy to assign 2 nurses every day per shift? You can assign more, depends on how many contracts you have in your pocket, and depends on how many nurses you have, because you may have 3 hospital contracts, 4. And if you start local in your area, then you can branch out into other states and become national eventually. Or you can pick up another state. You can register in another state. For example, if you start in Florida, you can register in Atlanta, in Georgia, and pick up another state. And then you start there. And the more nurses you assign, and I know I'm making it sound easy, but here's the thing. It is easy if you work it. It's hard work, guys. It is not something, as I said before, you have to carve out 2 to 4 hours every day. I'm not going to make it look like entrepreneurship is a piece of cake, because a lot of people go into entrepreneurship and expect money to come. Money cometh. Money is not going to come. You have to go for it, meaning that you have to dig deep, you have to search, you have to find it, you have to strategize, and you have to find where the hidden treasure is. That's the same thing with healthcare staffing. You have to really Google and find on cms.gov and find all the organizations in your surrounding, all the local organizations. Check out and see which of them are using staffing, healthcare staffing agencies, who are using supplemental nurses. Reach out to them. Hire nurses, your friends, hire, and I keep saying nurses, but it's not all nurses. I think because our companies are nurses. But remember, you can do any discipline you want to do if you are licensed and if you are legal. Okay, so how much do you need to start a healthcare staffing agency? Think about the starting fee, your insurance fee, your business fee, your overhead. And if you have an excellent client who pays, you may not need a lot of money. But if not, I would say have about 3 pay period or payroll, saved up, or get funding. Many of these payroll companies can help you with funding. Payroll companies that you can outsource. We have some, the one we use in our organization is called Paychex. Last year we used Intuit bookkeeping, but we use Paychex. We love them, and they really, really do a great job by paying our nurses. We submit the invoice and they take it from our business account. And it's very easy the way we do it. We outsource it to Paychex. In that way, it is done clean, it's done clear. If the nurses are employees and they have to pay taxes, they do all the taxes. If they are independent contractors, they do the same. It works out very, very great. There's another one called ADP. And if you're staffing agencies out there, and if you're doing your payroll yourself, that will take a lot of time from you. Just pay the fee. The fee is like $100 or even less per pay period. And you have one called Gusto, Gusto. They will help you with your payroll. These are all payroll platforms that you can use. ADP, Gusto, Paychex. You have many others, but I recommend Paychex because I love them, I work with them, and I enjoy them. There are many people out there who are using Gusto and ADP, and they love it. There are many funding sources that are available to help you with funding as well. So, so you work with small businesses to manage your payroll, your taxes, and of course your benefits if you want to give benefits out to your staff. So here's a warning for you guys. If you're out there and you're ready to start a company, you have to invest in somebody to mentor you or a coach, because you cannot see the picture when you are in the frame. A lot of people just wing it. And that's why you have so many names of agencies out there that are actually inactive because they are not making any money. They don't have a contract. They have been out for 3 years and they don't have any contract. Not, and the reason behind that is they have not invested in a coach or mentor who can teach them and help them to get contracts and to hire people and to streamline their staffing company to let it work. This is not a company this is not an industry, guys, that you can wing. You know, I try to wing my business when I transition from the corporate hospital healthcare as a healthcare leader to start my own business. I tried to wing it for a year, but guess what? I failed miserable because I could not see who I am in the picture. I thought that because I was a leader for so many years, I have been leading and coaching employees. I've been overseeing big departments and running hospital and all these things. I thought I could launch my business without a coach. I thought, hey, I can do this. I failed. Why? Because I did not know the business of business. I did not understand what it takes to be a business owner and own it as my business and work the business and spend time in it and carve out time to grow it. I was actually working in the business instead of working on the business. And it was not until I started investing in a coach. I invested in John C. Maxwell program. I invested in Marshawn Evans program. I invested in Andy Henriquez program. I've invested. Listen, guys, you cannot be a successful business owner if you have never invested. There are many successful business owners out there who have spent tons of money investing in their programs, thousands of dollars, and they get something from it because you cannot. I am yet to see someone start a business, wing the business, and make money. You need a mentor. You need someone who has been where you want to go. You need someone to help you and help you along the way to change the trajectory of your path. So as I said before, you do not know what you do not know. You cannot see the picture when you are in the frame. So I want to say to you, what are the keys to success in healthcare staffing business? The key to success: clients. You need clients. You need excellent staff. You need relationships with staff. You need the right payroll system, and you need to market. And as my final word is this: you have been given the power to get wealth. That's scriptural. That's from the Bible. I believe in it. You have been given the power to generate wealth. You have been given the power to succeed, to succeed, so you can do it. You have the infinite potential to do great in your business. So unleash it and tap into that entrepreneurial expertise that you have. Pursue your inner passion, unleash that creativity and impact lives. It's not just all about the money, but it's the lives that you want to impact. You want to generate income and you want to build influence and leave a legacy for your next generation. You also want to transform healthcare when you're successful. So that's what I have to say to you today. And we want to share with you how we can assist you. We want to share with you how we can assist you. And I want to open it for any program, because but let me share with you, after all of this, how can we assist you to build your program? Because we don't want to share this goodness and this juicy information and then you go out and struggle. So we want to see how many of you we can help in our program, because we are consultant here, and how we can assist you to build your staffing agency. So if you are interested in learning how we can assist you, send us an email. We have two ways: millions, $1 million, millions at myhealthcarestaffing.com. That's the email address. It's on the screen. Millions at myhealthcarestaffing.com. That's how we can help you. Send us an email if you have any questions. Or we have a program right now that we are finishing up. We have a program that we are finishing up right now. And in that program, this is a program that you can get some information from. We provide, it's a 4 weeks plus one, meaning that it's really a 5 weeks program, but we call it 4 weeks because the first week we work one-on-one with you to get you legal. So it's really a 4+1 week program. You get first week is one-on-one, the next 4 weeks is a group program where we teach you the steps to launch your business. We show you how to open up your business, how to launch, how to create, how to build it. We teach you how to get contracts, how to get funding, how to your payroll system. We give you sample forms, some sample policy and procedure templates, give you sample application form, list of things that your employees need. All of that is a part of the program that we can help you. And the way you can learn about that, you can go to www.myhealthcarestaffing.com. So again, you can send us an email and I will respond to you within 24 hours, millions at myhealthcarestaffing.com, or you can go on our website. It's www.myhealthcarestaffing.com. That's how we can assist you with building your own brand, building your healthcare staffing brand if you're looking to start. So with that said, I'm going to open it for questions. I'm going to open this for any questions that you have. Place your question in the chat. I can see them and I will answer your question. Any questions, please make sure you put them in the chat. And once again, if you want us to assist you, if you have a business already and you want to grow it, if you already launched but you're not making any money, you don't have any contract, you don't know what to do, go to our website and check it out, and you can sign up for our program. Our next program starts March the 4th. By the way, I didn't say that. Our program starts March the 4th. And if you sign up today, let me tell you what you can get in the program. It gives you a 15-page workbook, how to launch and lead. We get how to get your business legal, how to market and operationalize your business, how to recruit and retain staff. That's what's in the program. How to secure contracts and increase clients. The payroll resources, the funding resources. You get all permanent forms like direct deposit, background, application form, the clinical checklists that you're going to need for your staff, templates on employee handbook, template of policy. You get all of that in the program. And we have a 5 weeks program that starts March the 4th. And that program is very, very, very inexpensive. It's actually, the webinar rate is not $7.99. It says $7.99 here, but it's actually $7.79. It's less than that. $779 if you sign up within the webinar rate, because the normal rate is $9.79 for the regular rate. The VIP rate is $19.79, which is one-on-one. But if you want to get the webinar rate, which ends, this is just a 24 hours rate. If you sign up within the next 24 hours, it's $779. If you go up there to sign up with a lot of companies, you're not going to get what you're going to get in this. Literally, we hold your hands and give you everything. And in addition to that, you will join a community. You will join a community of like-minded professionals who have their agencies as well, those who just finished the program, and we will hold your hands and support you. You have unlimited email access for the next few months, you have after the program, you still can meet with me on a one-on-one basis for the until the end of the program, and maybe a month after the program. So there's a lot that you get for this 779 if you sign up within the next 24 hours. If not, after 24 hours, it's going to be 979 for the group rate. Or if you want a one-on-one where we hold your hands, one-to-one you meet for 4 or 5 weeks, is 1979. So this is what we have to offer you, and this is just our opportunity to help you and to offer something for you that you can start, because we know that this is such a great industry, and we want you to tap into this industry. We really want you to tap into this industry. So with that said, that's our presentation. I'm going to open it now for questions.